building a better Bay Area for a safe and secure future. This is ABC 7 News.
Hi, everybody. I'm Dion Lim, and welcome to our daily program. It's called Getting Answers. And today we're talking about systemic racism and how it all plays into housing. But first, let's talk about a project that just launched today. It's a partnership between the Chan Zuckerberg Initiative, their medical science research center, BioHub, and the state of California. And what it's doing is it's providing new insight into COVID-19. So joining me to explain what this means, how it impacts you as well in a very laboratory setting, CZ BioHub co-president Joe DeRisi. We should also mention that Joe was a key member of the team that identified the original SARS outbreak back in 2003. Thank you so much for joining us.
It's great to be here.
Yeah, before we begin, I think for all of us non-scientists out there, we have got to start with square one and understand exactly what a genome is and why it pertains to COVID-19.
Sure. A genome is all the genetic information that composes a thing, like a person or a virus.
Okay, so what does that mean? That means COVID-19 must also have all of these at play. And what does that mean when it comes to sequencing, and how many sequences have you analyzed so far?
Right. So what we're doing here is not just testing for the coronavirus, which we do here at the Chan Zuckerberg BioHub in conjunction with UCSF, but we sequence its genome, meaning we look at its genetic sequence. And that's important because it allows us to track where the virus has been and where it might be going next.
And how much of this tracking have you done? Because we are talking about something that is affecting every single person on this planet. And I know you have a limited team of volunteers. So what have you been able to accomplish? And also talk about the team at hand, who they are.
Absolutely. So here at the BioHub, together with our volunteers from UCSF, which are mainly graduate students and postdocs, we have a clinical testing lab that is offering COVID-19 testing and test processing to the county departments of public health throughout California. And to date, we've processed over 92,000 clinical results for Californians. Now, that team is also sequencing the viruses too, and that adds a new layer of information to this whole picture.
And you also mentioned partnering up with these counties. Have you partnered with them, and how many? And also, what has their feedback been so far? Because this is a very big asset to them when resources are a little bit crunched.
Yeah, so in terms of testing for COVID-19, we partnered with dozens of California counties. And for the sequencing aspect, we've been working with about 19 out of 58 California counties thus far to sequence their coronaviruses and add sort of that new layer of intelligence to their epidemiology and investigations.
Okay, so to the everyday person, I have to admit, tell us why this is important, how this pertains to our life, and why we should care. Because right now, it all sounds great, but unless you apply it to an example of how it affects us on a day-to-day basis, I think it's hard for people to understand.
I totally agree. So let's take an example. Let's say you're a public health official and you have two nursing homes under your jurisdiction, and there's an outbreak at both. One question you might have is, is the outbreak between these two facilities related? If it's related, it might suggest that either patients or staff are transiting between the facilities, and that would be, in effect, how the virus is getting from one facility to another. If they were totally unrelated, that would allow you to rule out that concept. And so by sequencing the genome of the virus, we can see which infections are indeed related, closely related, and more likely to be the result of direct transmission. And that would help us establish whether maybe there's a staff member or a patient that was moving between the two facilities. And if so, you could actually do something about it. For example, stop those staff members or patients from moving between facilities.
And of course, this applies to schools. Right now, we're talking a lot about whether or not kids need to go back to the classroom, whether or not they can do distance learning. How could this help in making announcements such as what counties need to actually go back and have a physical school?
Absolutely. So this just doesn't apply to nursing homes. As you said, it could apply to schools. It could apply to places where a lot of people live. It could apply to factories, to farms, all sorts of different things. And it also allows public health officials to look at the data carefully and understand whether there's ongoing continued transmission of the same virus. That is, maybe the contact tracing isn't working or where it needs to be better, or whether virus has now been introduced from outside, a new viral species, or I'd say variant that's never been seen before. And that would allow different kinds of control measures to be put into place.
Got it. And just a reminder to everybody out there, we are taking your questions and comments right now live on the station's Facebook page. We are ABC7 News. Now, behind you, I have to say, it tricked me for a moment because I thought you were in a real lab setting. But we were talking before the show, and BioHub, it reminds me a little bit of the Peace Corps and what you do and how you get those very skilled volunteers. Paint me a picture of what we'd actually see in headquarters. Is that what's behind you right now?
That's right. That is a picture of our clinical testing lab here at the Chan-Zuckerberg BioHub. We're a nonprofit research organization, but we're closely affiliated with UCSF, Stanford, and Berkeley. And early in March, when we got into the game, we thought, look, we need to get more testing to more Californians. How are we going to do that? And luckily, we have this incredibly well-trained workforce right across the street here at UCSF of postdocs, graduate students, and so on, that frankly, we're having to sit home, twiddle their thumbs during shelter in place. And we could put them to work, volunteering hundreds of hours of their time to produce and to execute more free testing for more Californians.
You know what, it's interesting what you're saying and the need for testing and how quickly you have a turnaround of 24, 48 hours seems to really be resonating with people on Facebook right now. People like Judy, who share the story of her daughter being in the ICU for 15 days. The situation is getting ridiculous because they're overrun with need. And then also people like Judy Haskins saying COVID tests taking over 16 days to get back. And also we had a story recently about a person from California, a man who flew to Idaho in order to get tested. Talk about how you identified the need, or at least the group of BioHub did, the need to make this a priority well before this became mainstream. I mean, back in February, you knew the importance testing would play in this based off of your research in past pandemics.
Absolutely. So in February, we already knew that testing was going to be a problem. At that time, there was very little testing available anywhere. No pop-up tents, not even poor turnaround testing, just no testing at all. And so early in March, we really rallied our troops together, got on volunteers, and with a couple key executive orders from the governor that allowed these things to get popped up, we stood up a new testing lab here at the BioHub that has now been executing thousands of tests every single day. And I do hear those stories all the time about these long turnaround times for testing. And it's terrible because, as we all know, a test that comes back 9 or 10 days or even later is frankly worthless.
Okay, and on the topic of testing, we're going to take a little bit of a break, but real quickly, Aditala, I believe that's how you pronounce your name, writes, why track when you can find a cure? We'll answer that question on Facebook in the break. Let's take a break on air. We'll be right back. Okay, so as I just read, one viewer wants to say, why track? Talk about the importance of it, because without tracking, there cannot be a cure.
Right, so tracking's really important. It doesn't substitute for a cure. You know, whether finding a drug or a vaccine, those are all independent. But let's just face it, in the meantime, we don't have a good drug and we don't have a good vaccine. And what we do have today is public health control measures. And being able to track it and understand how it's flowing from one facility to the other is what we have in hand today in our arsenal to combat this virus.
Playing on that, Julie wants to know about variants and mutations, because as I've been doing my preliminary research on this, the mutations can happen within 2 to 3 weeks. Is that right? It's very fast. You always have to be on the cusp of the latest information.
That's right. So the virus tends to mutate on average, 2 to 3 transmission events. That is 2 to 3 people later, there's a new random error somewhere in the genome. That doesn't mean that error does anything in particular to the virus, but it is a marker. It's like a breadcrumb that allows us to track where it's been and where it's going to next with some sort of certainty. So that's the aspect of it that's really important to us.
I see. And thank you for kind of shedding some light into that, because I think a lot of people were confused as to how can you tackle something that mutates so quickly. So I think that's a good answer to share with everyone. You know, as I'm going through some of these comments on Facebook, we appreciate you taking the time to write in. Please keep those questions coming. Our expert from the Chan Zuckerberg BioHub will be standing by for the next at least 10, 15 minutes or so to answer those for you. I'm culling through these. Let me see. N19. Oh, we're about 15 seconds back, so stay with us. We will be live on ABC7 over the air. Here we go.
5 seconds. 4, 3.
Once again, thank you so much for staying with us. We are back with the CZ BioHub co-president, Joe DeRisi, talking about their new project, also their new partnership with California to provide sequencing and analysis of COVID-19 and why it is so important. So, continuing our conversation, of course, your work is not just about testing. A lot of questions are coming in on Facebook about testing, but let's talk about the role genetics plays in helping the powers that be make decisions on how to stop the spread, what can stay open, what needs to be closed. You spoke about nursing facilities and also schools a little bit earlier.
Yeah, sure. And there's tons of examples like that. For example, a workplace or a factory or something like that. Imagine there's a small outbreak in a factory or workplace. Several people test positive. From a public health standpoint, you might want to know, did they get that infection from each other on the workplace, or did they coincidentally just happen to bring it in? That would make a difference for how you view that workplace in terms of its safety precautions, whether you shut it down or keep it open and whatnot. And the only way to really know that is from the genetics of the virus. If we sequence the virus, we can, with great certainty, tell whether one infection is highly related to another or completely not related. In the case where it's not related, you would say, okay, the workplace did not have anything to do with those people being infected, whereas the opposite could be true if it was related. And your decision as a public health official with what to do with that business could rely very heavily on that intelligence.
And this may seem like a silly question, but this is completely out of my wheelhouse, so you'll have to forgive me. Does this process take place entirely in the lab, or do you have people who are out in the field also gathering information? Talk me through the process.
Right. So there's two aspects to this. There's the field work with our departments of public health and their contact tracers and epidemiologists do. And then there's the lab work. And so the part that we've been talking about, the sequencing of the virus genetics, that all happens in the lab, sort of like the one that's depicted right behind me. And so a positive test would come in, and then we can immediately take that vial with the positive tests, extract the viral genome, not the human genome, just the virus, and sequence it all, and then put it in on its family tree to understand who it's related to.
And I do want to get to this one Facebook question before we get to our next question, because how accurate, says Sung Chu, are the current COVID-19 tests, and how often should a person be tested?
Right. So right now, there are many, many different COVID-19 tests. The one that we do here at the BioHub is based on PCR. It's one of the more classic techniques. It's very, very sensitive. It's sensitive down to maybe just 100 particles per milliliter. That's very, very few viruses. And it's essentially its limit of detection. Now, the question of how often it is you should get tested, well, right now, with the limitations on and scarcity of reagents and supplies and the testing turnaround time, if you're asymptomatic and you have no contacts with anybody that's ever been infected, and there's no reason to think that you would have COVID-19, I don't advocate that you get tested. Now, if you've had a contact with somebody that is symptomatic or is tested positive for COVID-19, that's a different story, and you should definitely get yourself tested.
I think eligibility is also something that people wonder about, because perhaps frontline workers you hear get fast-tracked to being tested. Who are the people who are eligible to get the tests that you're able to provide that have that very short turnaround time?
Well, right now, the testing that we do is really done through our county departments of public health and their associates. And so they are making decisions about which outbreak to investigate, which nursing home, which workplace. And so it's really dependent on their priorities. and their priorities are usually about stopping transmission chains and outbreaks. So they tend to be larger scale events, including jails and prisons and things like that. So we generally don't do testing for the pop-up tents that do just curious asymptomatic individuals.
I see. So it's really on a need basis. We are getting
That's right.
We're getting several questions about this. Lots of curiosity when it comes to mutations, including this one. When does a virus variant become a mutation, and what is the difference? Can you elaborate?
Right, sure. A genome is made up of the genetic code. It has, the 4 base pairs of RNA, ATC and AGC and T. In the case of RNA, it's AGC and U, but we'll just leave that out for a second.
Too scientific there.
A variant means a change in one of those bases, basically an error in the genetic code. And so any variant, any change is a mutation. Now, whether a mutation has any clinical significance, that is what makes the virus worse or better, that's completely unknown. That is not defined by just having a mutation. It just means it's different than the one that came before it.
Got it. And I know that we joked on the phone earlier today about this. You have been around for a long time. You have a very unique perspective, having worked on the SARS outbreak back in 2003. Can you compare the two, how they're being handled differently, and any, outlook that you have for where we stand in tackling this virus?
Sure. I really never thought we'd get to where we are today. I thought that SARS-CoV-2 was maybe going to be like SARS-1 back in 2003, where there was a little bit of an outburst. There were several thousand infections, but it was able to be brought under control, and it died away pretty fast. I thought that's what was going to happen when we were considering this in January. Now, by February, things started to look much worse, and by March, we knew we had a different beast on our hands. And this has gotten so farther out of control, so much into the realm of true pandemic, which it is, that we really needed to start thinking very differently about it. And I think what's different about now versus 2003 is the way the scientific community has really come together in new and fast ways. Folks are researching this virus, coming up with the ideas and testing hypotheses faster than ever before, and communicating those results to the world faster than ever before. And so I think we're really seeing an acceleration of science to deal with what otherwise would be or is a global pandemic tragedy.
Joe DeRisi joining us today to talk about the work being done by CZ BioHub. We appreciate you taking the time to speak with us and also answer those questions on Facebook. Joe, thanks.
Thank you.
All right, we are going to take a break on air, but the conversation that does continue on our live streams. That includes abc7news.com as we speak. Stay with us.
We're in commercial break.
Okay, hi everybody. Thank you for staying with us for our question and answer period. I know a lot of you have come up with, sorry, I'm getting some feedback in my ear. A lot of you have come up with some, what is that? You're seeing the behind. Oh, Joe, thank you so much for joining us. I know we got to a lot, but it also feels like we just scratched the surface.
Yeah, I'm still here if you want me.
Oh, okay, great. Joe, if you have a couple minutes. Oh, no, we got to move on. I'm sorry about that, Joe, but we will circle back probably in the coming weeks. Thank you for your time. Okay. Great. Okay. So now you're seeing the behind the scenes of what we do for this live interactive show. I have a laptop right here. I have an iPad with the scripts, and I'm trying to juggle all of the comments and questions that have come in from you, along with the different guests that we have. We go seamless, despite having commercial breaks on air. We also have no break during this time. So up next, let me go through my iPad and get to the next section. We're going to be talking about housing and the inequities for minorities when it comes to housing, because systemic racism, as I've learned over the past few weeks of covering this very issue, is that a lot of systemic racism stems from the housing situation and availability for housing for different minority groups. So right now we're going to switch gears, have a new expert. You just heard we have 30 seconds before we get back on the air on ABC7. So let me reset. Bear with me. Please submit any questions that you have about housing. And if you have any concerns about affordable housing, our expert will be with us in just a couple seconds. Here we go. ABC7 is committed to building a better Bay Area, and this week we're focusing on housing and the impact of COVID-19. So joining me now to get deeper into this topic is the president and CEO of the National Low Income Housing Coalition, Diane Yentl. Thank you for taking the time to be with us.
Hi, thanks for having me.
Great. Let's start off by talking about the issue of systemic racism and housing. We have been discussing it at length, especially this week here at ABC7, and the disparities for housing hit particularly hard for the Black and Latino communities. Can you explain why that is and the history behind it?
Sure, you're absolutely right that the current crises have heightened the threat of eviction for Black and Latino renters, but that threat is not new. So decades of racist housing policies, from redlining to block busting, restrictive covenants to restrictive zoning, has purposefully put homeownership out of reach for African American families. And so it has also then put out of reach for them the way that most families build wealth. So it's created this generational yawning wealth gap that results in today the average white family has 12 times the wealth than the average Black family does. So this structural racism leaves people of color disproportionately likely to be renters, disproportionately likely to be low income, disproportionately likely to be rent burdened, even disproportionately likely to be homeless. So these inequities now compound the harm done by COVID-19. Black and Native Americans are bearing the brunt of infections and fatalities. Latino and Black people are bearing the brunt of these historic job losses. And now their homes, and with it their ability to stay safe and healthy, are at risk.
I do want to talk about redlining in just a moment, but before we get to that, for many families, buying a home is part of that American dream. It's an investment into their future. We're seeing home ownership less and less in different minority groups, and renting as well, like you just mentioned. Are there areas that are more hard hit than others?
Well, it's true that the homeownership levels for Black families today are lower than they were even when discrimination was legal. And that is in part due to some of the historically racist housing and transportation policies that I mentioned earlier. It's also related to the fact that Black families and Latino families were hit hardest by the foreclosure crisis in 2008. They disproportionately lost tremendous amounts of wealth and their homes, and still today have not recovered from that foreclosure crisis. So their home ownership rates are much lower than white home ownership rates are.
I feel like it's just compounding one issue on top of another. And now we're dealing with COVID-19. Of course, we've covered all of the issues surrounding coronavirus and how that prevents people from, let's say, going to work, or how that prevents them from actually bringing enough income to have a home of their own, so they have overcrowding issues. How does coronavirus play into this now?
Well, it's a tremendous challenge. And I think to recognize the challenge, the housing challenge that people are facing today during coronavirus, we have to recognize where we were even before coronavirus came to our country. And that was in the midst of a severe affordable housing crisis, where we had a shortage of 7 million apartments affordable to the lowest income renters. So another way of saying that same number is for every 10 of the lowest income renter families, there were fewer than 4 apartments affordable and available to them. So because there was such a shortage, we had over 8 million of the lowest income renter households, so over 20 million people in those families, that were paying at least half of their income towards rent, and many were paying much more, 60, 70, 80% of their income just to keep a roof over their heads. So when you have such limited income to begin with, and you're paying so much of it for your home, you're always one financial emergency away from missing rent and maybe being evicted, and in worst cases, becoming homeless. So for many of these same renters, the coronavirus is that financial emergency. They've lost jobs, they've lost hours at work, they're losing wages, and it's harder than ever for them to cobble together what they need to make rent.
And what is that percentage people should be paying in their rent or on their housing? Because you mentioned some were forced to pay 80% or more. Of course, that's not sustainable.
It's absolutely not sustainable. Most all really housing experts agree that none of us should be paying more than 30% of our income towards our housing costs. And that's to ensure that we have money left over for all of life's other necessities, whether it's healthcare or childcare, food, transportation, everything else. So when low-income people have very limited incomes to begin with and are paying such a high percentage of it to keep a roof over their head, then again, even before coronavirus, they're having to make very difficult trade-offs to make that work. So they're not buying medicine, or they're not buying store-bought food, and they're going to food banks instead. And they're finding all sorts of toxic trade-offs in order to keep that roof over their heads.
Diane, we have about 1 minute left, but I really would like to ask you is where do we go from here? We've seen that there are government stipends, there are different measures being put into place. Is it enough? And what would you like to see going forward to solve this problem?
So it's very clear that without a significant federal intervention, we will see a wave of evictions and a spike in homelessness across the country. But that wave is preventable. Congress needs to act now in order to prevent it by establishing a uniform moratorium on all evictions for non-payment of rent for the duration of the pandemic, and providing at least $100 billion in emergency rental assistance to keep people stably housed during and after the pandemic.
Wow, it is an astronomical number. Diane, thank you for joining us on air. This question will continue to be answered over on Facebook. So I encourage everyone right now to head to www.abc7news.com. Also on our Facebook page, we are going to continue answering that question. Stay with us. Okay, Diane, is there anything else that you'd like to elaborate on for what you personally would like to see? Because obviously, this is an astronomical number. How likely do you think that could potentially come to reality? And then also, when? Because this is such a long-standing issue that has been decades and decades of problems compounding on top of one another.
Yeah, so a few things to say about that. One is that just to expand a little bit on the solutions, the uniform moratorium on evictions for non-payment of rent is essential. The very least the federal government ought to do in the middle of a public health emergency is ensure each of us that we're not going to lose our homes during it. But eviction moratoriums aren't on their own aren't enough, because they create a financial cliff that renters can fall off of when the moratoriums are lifted and back rent is owed. And that's why that $100 billion in emergency rental assistance is essential to prevent low-income renters from spiraling down into poverty and into debt that they can't pay off, and also to ensure that small landlords can continue to maintain and operate their properties and have rental income coming in. So the $100 billion has already passed the U.S. House of Representatives, and not just once, but twice in the HEROES Act and also in another standalone piece of legislation, and so has the eviction moratorium. So the Senate now needs to act, and this will be part of the negotiations for a final bill. The question is whether the Senate is willing to act on the scale necessary to prevent this eviction wave that's otherwise coming.
I see. Something that we'll undoubtedly continue to watch. Thank you, everyone who submitted questions live for our expert, Diane. Once again, we appreciate you being here today.
Thanks so much for having me.
Okay, so for everybody, we are just a few seconds away from being on air, 15 seconds. And, okay.
8, 7, 6, 5, 4, 3.
Once again, thank you so much for joining us for this interactive show, Getting Answers. Hopefully you learned something new about the new project from CZ BioHub. They are sequencing and analyzing mutations in COVID-19. It sounds pretty intense, very scientific, and it is, but our guest, the co-president of BioHub, was able to break it down for us and to understand why it is so important. We'll be here every weekday for you at 3 p.m. on air and online, answering your questions on Facebook Live and abc7news.com. I'm Dion Lim. World News Tonight is next. Facebook, thank you so much for joining us. We will be right back here tomorrow at 3 p.m. Make sure to join me on Facebook as well. I am Dion Lim TV. Signing off.